What are common bone cancer chemotherapy dosage and schedules? When it comes to treating bone cancer with chemotherapy, doctors use carefully planned combinations of drugs given in cycles. These cycles allow the body time to recover between treatments and help improve effectiveness. The specific drugs, doses, and timing depend on the type of bone cancer, such as osteosarcoma or Ewing sarcoma, as well as how advanced the disease is and the patient's overall health. For osteosarcoma, a common approach is the MAP regimen, which includes high-dose methotrexate, cisplatin, and doxorubicin. Methotrexate is given intravenously, often every 1 to 2 weeks, with doses that can vary but are usually high to target the tumor effectively. Cisplatin is typically administered at 60 to 100 milligrams per square meter of body surface area every 3 to 4 weeks. Doxorubicin is given at 40 to 75 milligrams per square meter every 21 to 28 days. These drugs are usually given in cycles every 3 weeks, with the total number of cycles depending on how the tumor responds and the treatment plan. For Ewing sarcoma, a common chemotherapy schedule involves the VDC and IE regimens. The VDC includes vincristine at 1.5 milligrams per square meter on the first day of each cycle, doxorubicin at 75 milligrams per square meter every 21 days, and cyclophosphamide at 1,200 to 1,500 milligrams per square meter every 21 days. The IE part alternates with ifosfamide at 1,800 milligrams per square meter daily for 5 days and etoposide at 100 milligrams per square meter daily for 5 days. These cycles are repeated every 3 weeks, often for up to 14 cycles, depending on how the disease responds. In cases where the disease has relapsed or is resistant to initial treatment, doctors may use second-line regimens. These can include combinations like ifosfamide with carboplatin and etoposide, with doses such as carboplatin at 400 milligrams per square meter on days 1 and 2, ifosfamide at 1,800 milligrams per square meter daily for 5 days, and etoposide at 100 milligrams per square meter daily for 5 days. These are also given every 3 weeks. Another option is a combination of Dosage at 75 to 100 milligrams per square meter and gemcitabine at 675 milligrams per square meter on days 1 and 8, repeated every 3 weeks. For metastatic bone sarcomas, sometimes a single drug like doxorubicin is used at 60 to 75 milligrams per square meter every 21 days. This approach is chosen based on the extent of the disease and how the patient tolerates treatment. Overall, chemotherapy is usually administered in cycles every 3 weeks to give the body time to recover from side effects. Doses are calculated based on the patient's body surface area to ensure the treatment is tailored to each individual. The total number of cycles can range from 4 to as many as 14, depending on how the cancer responds and the patient's health. Adjustments may be necessary if side effects become severe or if organ function is affected. Supportive medications, like Mesna, are often used with drugs such as ifosfamide to protect the bladder from toxicity. Because chemotherapy can cause side effects like low blood cell counts, nausea, and heart issues, especially with doxorubicin, close monitoring by healthcare professionals is essential. They will adjust doses if needed to keep the patient safe and comfortable. It's important to remember that each person's treatment plan is unique. Doctors consider many factors to decide the best schedule and doses. Patients should always follow their healthcare team's advice and never change their treatment without consulting their doctor. Chemotherapy remains a cornerstone of bone cancer treatment, often used before surgery to shrink tumors or after to eliminate remaining cancer cells. Always seek personalized medical guidance to ensure the safest and most effective care.